Welcome to this overview of the Community Living Center rotation here at the James A. Haley Veterans Hospital in Tampa, Florida. My name is Bethan Roberts, and I've been the CLC psychologist here since September 2018. The CLC rotation is a geropsychology-focused rotation in a rehab and long-term care setting. Veterans may stay at the CLC for a short time or for the rest of their lives. It is a place where veterans can receive nursing home level of care, which includes help with activities of daily living, skilled nursing, and medical care. The goal of community living centers is to restore each veteran to their highest level of well-being, to prevent declines in health, and to provide comfort through the end of life. Our CLC is named Haley's Cove and was built in 1984. It is located on the northeastern corner of the main hospital site. It consists of 4 floors. The ground floor, which houses the Acute Rehabilitation Center, our inpatient psychiatric unit known as the ARC, and connects the CLC building to the main hospital. The first floor houses occupational health and the GeriPact, or Geriatric Primary Care Clinic. And the second and third floor comprise the 45-bed CLC and 10-bed hospice units. While rotating on the CLC, you will work with 2 veteran populations, a short-term rehabilitation population and a long-term care population. Our long-term care veterans are here indefinitely, and the CLC is their home, while our short-term rehab veterans stay with us for as little as a week and up to 90 days, depending on their rehab needs. The veterans that come to us for rehab have the goal of returning home, or often to an assisted living facility. They come for a variety of reasons, including post-surgical rehab, general deconditioning, amputation, or need for IV antibiotics. On our long-term care neighborhood, we house a number of veterans with skilled nursing needs, many with advanced dementias or serious mental illness. There are other areas for rehab at the Tampa VA, and what sets our short-term rehabilitation population apart is that the veterans admitted to the CLC for short-term rehab tend to be those that are more frail who would not be able to handle 3 hours of daily rehab that's required in other settings. So the CLC is a great opportunity for those with a rehab interest who would also like experience working in a geriatric and long-term care setting. Across the 2 populations, there are many presenting concerns. Intervention opportunities are primarily individual. However, there are also sometimes opportunities to work with family members and caregivers of the veterans. As far as intervention approaches, I tend to use cognitive behavioral-based interventions, acceptance and commitment therapies, or problem-solving therapies most often. I also include motivational interview approaches, and for our long-term care veterans or those nearing end of life, you might have the opportunity to engage them in life review or reminiscence therapy and dignity therapies. In addition to using adapted EPPs, you'll also learn how basic but skilled interpersonal engagement can be assessment and treatment approaches in themselves. And this helps with maintenance of sense of self of individuals with cognitive loss and has a unique and significant benefit of just having a consistent, supportive therapeutic relationship. Interdisciplinary care is the gold standard in geriatrics, and at the CLC, you'll have the opportunity to work with a range of other disciplines. The CLC has medical teams of nurses, physicians, nurse practitioners, and pharmacists. We also have dietitians, speech, occupational, physical, kinesio, and recreation therapists, social workers, psychiatry, and of course, psychology. You will learn to work alongside this diverse group of professionals and develop the skills needed to communicate recommendations and findings and collaborate in caring for veterans with complex needs. There may also be opportunities to participate in weekly medical rounds and family meetings. There's also the opportunity to do several different types of assessments. These can include brief cognitive screening, more in-depth cognitive evaluations, and evaluations of capacity. As with interventions, you'll learn to adapt assessments for the population and environment, and learn to use observational data during interactions to help track changes in cognitive functioning over time. The CLC is home to many veterans with major neurocognitive disorders, ranging from mild to severe. This provides opportunities to combine assessment and intervention in dementia care through behavior analysis approaches. Opportunities are available to work closely with nursing staff to create appropriate behavior intervention plans. You'll learn common activators to dementia-related behaviors and ways to intervene individually, on a team level, or to make other environmental changes to reduce distress. You can also observe interventions for under or overstimulation concerns, such as robotic companion pets and snooze sensory therapy. Situations that require these types of assessments and interventions often go hand in hand with ethical dilemmas and provide the opportunity to work through the complexities of balancing autonomy and safety of veterans and staff. In addition to navigating some tricky ethical dilemmas, you may also have the opportunity to advocate for the veterans you work with who may have trouble advocating for themselves due to cognitive or communication difficulties. This may include staff education to ensure the team has realistic expectations of a veteran's abilities. A significant number of our veterans that reside at the CLC may have or may also need a guardian, so there may also be opportunities to better understand the guardianship process. Psychology is highly involved in our Culture Transformation Committee, and I currently serve as the chair. Key initiatives focus on maximizing a home-like environment, improving staff-resident relations, and care through veteran-centered practices. These practices ensure and preserve the respect of each veteran's dignity, individuality, preferences, and emphasize community, physical, and emotional comfort and support. Other administrative aspects of CLC psychology include participating in quality assurance and process improvement. This involves tracking national quality metrics and attending quality and improvement meetings. Some areas that are tracked nationally include antipsychotic and sedative use. Psychology is involved in this tracking in encouraging non-pharmacological approaches to care to reduce unnecessary use of antipsychotic medications in dementia care. As far as supervision, my goal is, of course, to meet you where you are in terms of your knowledge of geriatrics and the inpatient environment, with the goal of supporting you in becoming as independent as possible by the end of the rotation. I'll typically have you observe me, be observed, and then you'll be able to go and do things independently. I also like to reference the Pikes Peak training competencies for geropsychology to ensure you're getting a well-rounded training experience. And I'll ask you to complete a self-assessment with this tool at the start of your rotation to help you develop your training goals. Supervision will also include discussion of historical events and the diversity of veterans' life experiences based on their age cohorts, differing war periods, SES, identity, and cultural differences, among others. I encourage trainees to identify areas of interest or topics related to their individual cases and find an article for us to discuss together. My goal is to tailor the rotation to your training goals, such as focusing on one population or type of assessment or intervention, while maintaining a well-rounded experience. Thank you for listening to this overview of the Haley's Cove CLC rotation. Please reach out if you have any